No, it's working without it.
Good morning, everyone. Am I audible?
Yeah, Maulik, you're audible.
Okay. Once again, dear all, a very good morning and a very warm welcome for joining this webinar on building your Salesforce of tomorrow. I'm very much sure that all of us would enjoy this webinar as it will answer some of the very important questions of this industry, like keeping the sales representative motivated, how they can deliver high value to the customers and consumers, and how they can become performing teams, best performing teams with the help of artificial intelligence, neuroeconomics, and behavior science, which will ultimately lead to boosting sales productivity. Sorry. Let me give you a quick introduction on the speakers we have today. So we have Ms. Gauri Chaudhary with us, who is the co-founder of Brand Innoworld, and she comes with 27 years of experience in the healthcare industry. She has also been training and coaching marketing teams in pharma industry for the past 15 years. Her company, Brand Innoworld, is a healthcare brand consultancy that specializes in creating and building healthcare brands. Gauri has also authored the book named The Perfect Pill, 10 Steps to Build a Strong Healthcare Brand. The second speaker that we have on our panel is Mr. Ramesh Srinivas, who is the founder and CEO of WorkZogo. He comes with decades of consulting experience, and he was a part of leadership teams in multinational firms like PwC, KPMG, and IBM. WorkZogo is a technology company whose proprietary artificial intelligence coach called Mia boosts sales productivity using behavior science and neuroeconomics. WorkZogo uses behavior concepts like persuasive mechanics, nudge theory to bridge the gap between intent and action, and help sales representatives develop productive work habits that deliver better outcomes. So, dear all, we will have speakers talk for 40 minutes, which will be followed by a question and answer session for 20 minutes. Whenever you have a question, just type it on the questions pane that is visible on your window, and it will be directed to the speakers. Once again, a very warm welcome, and let's enjoy this. Over to you, Gauri ma'am.
Yeah, thank you so much, Maulik. Good morning, everyone. And I'm really thankful to you for having me on this panel. Before we actually start how we increase productivity, how do we keep Salesforce motivated, I thought it might be a good idea to set a context. What has changed in past few days? Maybe what has been always changing for so many days? Who got it right in terms of pharmaceutical engagement with doctors, and why did they get it right? And what are the traits of the future salesperson? And maybe after that context is set, Ramesh probably will have very insightful ways of actually engaging Salesforce through neuroeconomics, AI, and the wonderful Mia that you have. So basically, everyone is knowing that lot has changed. But what has actually changed for healthcare industry is there is a journey towards new normal. Probably, there were a lot of concerns to begin with. There were solutions. And again, from the solutions, there are some concerns here. So basically, if we look at the changes, they have happened at consumer and patient levels, doctor levels. The pharmacies, very interestingly, have changed, and pharma brand sales and marketing teams have changed. Just to quickly figure out what changed with, even at the cost of maybe repetition, that what has changed with consumers and patients is that at the attitudinal shifts have happened. I wouldn't really say that behavioral shift probably have happened, but yes, in terms of attitude, health has gained top of mind. A lot of preparedness in terms of health is happening. People started hoarding, in fact, some of the medicines. A lot of those medicines were preventive medicines, and the wellness care came into the picture. We also saw increase in insurance policies being sold off. So there is this concern there. Some of it probably, which was an easier one, got translated into action, but some of it is not really so far. So maybe in terms of behavioral shift, what has happened is that, like all of us have realized, and wonderfully well, is that physical presence is no more important. All of us are actually sitting here in this webinar without any geographical barrier, without any, having really stretching ourselves out of our current situation and attending something. So it has really worked pretty well. And what has worked for us has also worked for a lot of patients and doctors. And a lot of it is also for e-pharmacies. They have really stretched themselves out. They have, in fact, like SARS made e-commerce happen in a big way. Probably this is that moment for e-pharmacies today in India, who are struggling so far, but they have done their bit wonderfully well. In fact, they also provided e-consultation platform and fulfillment of prescriptions, and that's something really remarkable and may stay here. So what were the concerns with HCPs? I mean, past 3 weeks to 4 weeks, we all are extensively talking to doctors, understanding their concerns, and what probably has really comes at the top of everything is that fear of corona. To begin with, everybody was wondering what should they do? Are they already infected? Is there any way to figure out? Some of them went on prevention. Hydroxychloroquine was taken as prevention by some of the doctors. Unfortunately, we lost 2 doctors to that kind of fear. I mean, doctors who actually didn't succumb to coronavirus, but to the solution of it. So IPA, OPPA, and various organizations actually went out and told doctors, don't experiment, don't take it unless necessary, and the guidelines were put. Everyone, I mean, every pharma company today is wanting every pharma professional to give a message out to everyone that don't just take it, casually. Another thing that really worried doctors is that lack of patience, because while the corona fighting HCP segment was out there working 24/7, there were non-COVID-19 treatment doctors basically did not have enough patients. And actually, some of them did go to their dispensaries and their consulting rooms, but there were no patients. So lack of patients and absolutely not having anyone out there was a concern for a doctor. Another thing which is playing on their minds right now is loss of patience, which means is that a patient who was with them before corona may not come to them afterwards. The reason being that every patient probably maybe of a chronic ailment or diabetes, cardiac problems, have found out a solution to reach out to some doctor, whoever was available, and may continue to stay with that new doctor or new system. So that's what is bothering some of the doctors. There is concern for patients. Everyone, particularly diabetologists I spoke with, they were saying that I don't know what's happening to my patient. Are they eating right? They are definitely not exercising the way I had told them, and as such, that is so difficult to make lifestyle changes with lockdown. They're concerned and they expect some severity of situation or the condition that would happen once the lockdown is over. Another worry for patients all the doctors had was the unfulfillment of prescription. Now, some of the brands are not available in the market, and doctors are bombarded with questions. Doctor, this is not available. What do I do? Do you have any answer? So that's what is across the specialties. Doctors are struggling, kind of trying to help. And of course, as I said, severity of condition, they are expecting some patients may come back to them with slightly severe problems. The biggest worry right now doctors have is the financial burden. Most of them have their dispensaries or they have their consulting rooms for which they are paying rent. If it's a diagnostic or a path lab, they are paying their staff, they are paying for the the fixed costs, and they are wondering when is it going to end. So this financial burden and sustainability particularly is what is bothering them right now. So what has changed? So these concerns also came up with some solutions. We know that Telemedicine Society of India was launched 18 years back, and they were encouraging doctors and patients to go for telemedicine. Unfortunately, it did not pick the way it should have picked it up. But right now, TSI and MCI together have come up with enough guidelines and directions for doctors to actually start seeing non-COVID patients or even COVID patients in an e-consultancy manner. Though there are better platforms available and with very clear understanding of how telemedicine should work, what patients have quickly done is they have picked up their phone and they have started talking to doctors, and doctors are now allowed to do so, and they are also their prescription, that their e-prescriptions on WhatsApp are accepted, and these are legal prescriptions. So that's what is happening. Some doctors who were ahead of the curve actually moved on to better mobile and web-based platforms which have better diagnostic tools available, and they are comfortable. So there is learning happening, and there is certain kind of earning also happening, though many doctors are actually wondering how would they charge their patients, because they are so used to actually seeing patient face to face and then charging for that time. Right now they are struggling with it, but some of them have figured out the ways around it. So actually, the TSI has been told by Government of India that they should be training 5 lakh doctors and in the coming year for telemedicine. And it starts from basic guidelines and basic, there can be certain amount of medico legal hassle here because there's a protocol to it. It is not that you have just consulted a doctor, the patient has to be recognized, and those kind of things. Also, what kind of technology is really necessary for diagnosis, and then how do they manage patient remotely? And this is what, there is learning curve happening. Definitely for TSI, it's a huge task. So partnerships are needed in this situation for the on-ground implementation. And things may not immediately change after lockdown. We are not going to have patients coming and crowding waiting rooms. So telemedicine is here to stay, and doctors and the organizations do require some kind of help and partnership there. So what has changed for pharma sales and marketing? I mean, I think the first and foremost, everyone was concerned that, am I missing out? So there was that fear of missing out. What other companies doing? What are they doing? After that happened, knee-jerk reactions. I think simply sales representatives started sending messages to doctors, and doctors simply pushed them back, because what you would do face to face is not accepted by any other medium in the exact format, and doctors felt bombarded, and they felt it was irrelevant for the given time and the given situation. So there was this perception that doctors don't want pharma companies to stay in touch. But the reality is that fruitful engagements actually were welcomed wholeheartedly. In fact, if we see Equia's report on the market research report that they did with 500 doctors, it very clearly says that doctors are welcoming WhatsApp, they welcome emails, and a lot of webinars and seminars are being welcomed. But having said that, only those webinars worked which were actually engaging doctors into something that doctors were interested. And many webinars actually in past 1 week went absolutely empty, because doctors would say, I have 15 requests and which of this I should be attending. So anything that caught their attention, which was relevant to them, happened. And anything that was kind of a push for them, they simply rejected. So not very different from what happens otherwise in doctor's clinic. So who got it right, and why did they get it right? So those who had their ears to the ground and those who had empowered field force to hear those nuanced feedback of the doctors got it right. And those who probably did not have that struggled initially, definitely, and over a period of time they are learning it. But definitely those who listened properly and those who had fantastic relationship with the doctors through field force have seemed to have done fantastically well. So one wouldn't say that companies got right. Some of the companies, of course, got it right. But within companies, some divisions struggle to get good engagement with doctors, while others beautifully entered and they have actually built brands over a period of time. So at places, it is divisions, maybe some brand managers got it right. And at places, simply the sales representative got it right. So there are multiple layered approaches, and it's not that one as a whole actually got answer right. And why it happened? Because their ears were to the ground, and very importantly, motivated Salesforce who ensured the last mile implementation. In a way, if we look back at the hindsight, everything is known to us, clear to us, but that implementation is very critical, and some of the companies actually manage that. So while marketing people thought segments and created strategies, the salespeople actually thought of individual customers and they actually tuned it to the requirement of customers. So relevance and definite action is what worked well for those who could actually manage to engage their customers beautifully in last 4 to 5 weeks. So basically what we see, there are three types of brand in our industry, new category brands, categories and the brands within those categories obviously took help of science because there was a lot of new thing to say through webinars, video meetings, scientific mailers. Some of the high involvement therapy areas where there was nothing new to talk about in terms of therapy or in terms of molecules used patient support platform. They help doctors help their patients. And some of the non-involvement categories like maybe cough, cold, or maybe antibiotics, which are there for quite some time, they did something interesting, relevant, and unique. So just to give some example, some companies actually gave COVID-19 kits, and I was talking to doctors and they're so thankful to them because doctors really needed basic gloves and masks were not available initially. So companies who did that, doctors are thankful to them. Some companies actually had helpline numbers and they said, just call if you have any difficulty, doctor, and doctors appreciated it. Though a lot of sales representative actually called doctors and said that if doctor, if you need something, call me. I am here to help you within my own capacity. So it happened for in some cases through companies, but in many cases, actually the representatives took it up on themselves. And in the end, when this whole game is about relationships, doctors really valued this kind of help. And I'm sure that built the relationship further. Calls for sample was another thing that happened. A lot of doctors did say that they need some kind of samples because their patients said they are not getting it. It happened a lot in area of psychiatry and neuropsychiatry. Reason being, as such, getting those medicines in metro places is very difficult. Not every medical shop is generally ready to dispense narcotics or hypnotics, those kind of medicines. You heard those patients when were running out of it with such high level of anxiety. They called medical representatives and they said, can you arrange for it? And they requested for samples, so it worked. Some companies actually launched a stock app for chronic ailments. Now, that was a very strategically great initiative because if a particular medicine is not available in particular area, the representatives actually navigated and helped doctors and patients to let them understand where stocks were available. So that was another great initiative. Webinars which worked very well for low involvement categories were medico-legal webinars. A lot of the doctors these days are concerned and are of course interested in this topic. Financial management is another one which in my understanding has really done well. A lot of doctors with these issues of sustainability are keen to know a little more about this at equity analysis seminar. So that is what has done well and kind of has built relationship with the company and of course the sales representatives. Some representatives very interestingly did videos for patients through doctors. A lot of doctors were bombarded with the same questions. And these reps actually told doctors that why don't you simply shoot a video? I will edit it, I'll word it, I'll put a subtitle to it and you send it to your patient. So those kind of innovative ideas from representatives worked very well. Digital tips for consultation, given the fact that we have young sales representative field force and slightly older doctor segment, this combination worked very well. Given the advantage of age and generation, these representatives were really good at doing this and they added value to doctors' practice, or rather e-practice. Also, what worked was emailers and webinars on issues like what, when, and how of clinical practice in COVID and immediately after COVID-19. What comes first? Is it the patient or the self-safety and the safety of society in general? I know a lot of doctors today are saying that the buildings in which they have their offices are telling them not to have patients coming to those buildings for next 2 months because none of the buildings want to take that kind of risk. Post-lockdown exit policies, how should they work around it? And of course, patient management. So last mile helping through sales representative in actually identifying and resolving some of the issues has helped. Some of the international trends, if we look at what happened internationally, particularly in Western countries, which faced COVID-19 slightly before, and what role did the field force play? So what worked very well for them is e-detailing. All this while every company wanted e-detailing to work and doctors were resisting. Today, doctors are demanding e-detailing. The kind of detailing they liked were done by self-representative. And I'm quoting this from Ipsos survey. Ipsos has done it across 5 countries, and they have done it last week of March to first 2 weeks of April. And they figured it out quantitatively that what worked was the sales reps who actually came for e-detailing, or the medical department person. They didn't really want anyone else doing it for it. And the reason somewhere, in my opinion, is that doctors do want to see the representatives. Even here in India, I know 2 diabetologists who have actually started WhatsApp group for the sales reps of various companies. And they say, oh, hey, I'm missing you all. How are you all? So I don't want to generalize it, not that everybody wants it, but there is a psychographic segment of doctors, and I'm talking about 2 big names in this industry, the diabetologist in the city, who actually have created this WhatsApp group telling representatives, hey, come tell me what's happening in your life. We are missing you. So I'm not surprised when Ipsos figured it out that a sales rep talking to through e-detailing is something that is welcomed. So video conferences and phones have worked. So first is the video conference, followed by phones. What doctors really liked was the scheduled calls, a call with new information, and on an average, every e-detailing went on for 10 minutes, and that's huge. Of course, we can say that relatively doctors are less busy with patients right now, so one can say those 10 minutes can also be attributed to it. But well, I mean, e-detailing is something that doctors have really welcomed. Another thing is that they actually, what worked was dialogues. So many times in clinic, in person, doctor detailing is more around the material. But here what doctors really enjoyed was the dialogue, and who could do this dialogue was welcome more frequently than the other. And dialogue was around patient types and treatment issues. So in the Western world, this is what worked wonderfully and is reported by Ipsos. So what are the sales traits of new in this in this particular times? What is it that working? So it's not the push but the pull. Telling doctor I have something interesting to say, something relevant to say, and actually asking him for scheduling appointment. And if he is ready to schedule it, then working around it has worked pretty well. Customer intelligence, that's very critical. I mean, today we have technology which can tell us what is the area in which doctors are interested. Uh, in fact, I read one case study where, which says that currently oncologists are trying and understanding the relationship between, they're actually trying to understand more about obesity. I mean, I wouldn't say the relationship, but they're somehow very interested, and they are actually on the web. That is what they're figuring out. Now, if you have that idea, you exactly know what is interesting to your customer, and it's not very difficult in today's time to understand. So having that customer intelligence, being digitally savvy, and then of course more of dialogue and absolutely no parroting is what is going to work. And these particular traits have helped internationally. Less frequent but much longer, deeper, richer interactions are happening. So looking forward, both at local and global level, we can actually expect some lost demand, but there is also this pent-up demand. There's a possibility. A lot of patients are going to go and visit diagnostic centers and their doctors, so there might be pent-up demand, and they'll have issues related to how to handle it within the social distancing norms. Severe representation of symptoms may happen, and maybe we'll see second line, third line treatment options coming into front. There would be pent up surgeries because a lot of surgeries got cancelled, and there is a possibility of that may increase. There's a good chance that there will be a change in brand prescription, while or maybe of the same generic or maybe of something else, but there's a good chance of in a chronic situation that patient has simply switched a brand because the brand on which he was managed is not available anymore. and may stay with that brand for longer period of time, the new brand. There is going to be a decline in immunity suppressing therapies because overall doctors are saying that they will stay away from them. So we can expect some of the drops in, steroid prescription or, similar categories. Immunity builder prescription is going to go up because patients are going to demand again. They have tried and done something in last 15-20 days, but they are going to, ask doctors that should I have this or should I have that kind of thing. That will go up. Emergence of new technology platforms. I think wonderful work done by some medtech companies, but because they don't have this last mile connect with the doctors, they are failing. They are not reaching out, but they have some wonderful things to offer to doctors, both for e-consultation as well for patient management. And that's those who are active and slightly ahead of the curve doctors are going to lap it up. So any one wanting to help this synergies to come together is, worth exploring. And there's going to be remote diagnostic, which is going to stay here because it also works economically very well for patients, doctors, and overall for the expenditure on health sector for the government. So if we look at what has worked, so definitely relevance has worked, and through known face. So building relevance for the brand through a known face, which is the medical representative, has worked. Also, we have to look at this relevance through two windows or two openings. One is that in terms of content, have you given the content which is required? And secondly, has the technology come to your rescue in this particular period? What I mean is that what are the key concerns of doctors and their areas of interest can help for development of content. But simple things like email IDs and mobile numbers of the representatives can actually take brands to another level, because we have been telling our representative to collect this kind of information, but I still understand best of the companies today do not have 100% data of emails and contact numbers of doctors. Now, if we have had it, we could have used technology to the best possible use. We could have actually traced some of the footsteps of the doctor on various platforms. So a lot can be done if these basic things are available to us. Of course, within the framework of social responsibility expectation, but that's something needed. And, those companies who manage to get it are definitely ahead of the curve. So in-house customer intelligence, if it was available, or could be the sales rep who are in contact with doctors and actually get all this even now, will take brands and the companies to another level. Is it something that COVID-19 changed, or was it already changing? The answer is no. A lot of it was already changing in terms of we always knew that we needed to add value and we have to be relevant in doctor's clinic. Digital ways of consulting were consulting patients was always there. Digital ways of marketing were always there, and need for new age representative was also there. The thing was that those companies which were actually ahead on this curve were ready to reap the benefits, and the rest probably struggled in this journey. So the winners basically were those who were brand ready, whose brands were strong brands, the brands which were built on fundamental principles, those who were technologically ready, those who had even the basic things about the doctors ready. They were technologically, ahead of the curve. And of course, those who were rep ready, who were ready with their representatives, who were empowered, who were ready to act and implement. So the new traits of a salesperson in the coming times, and that's going to stay here because it is not only COVID-19 which has changed it, but in fact, these are the traits a future salesperson must have. And more than a salesperson, he is going to be the chief coordinator officer of the health for the brands, because he has to navigate through various activities that would happen and that would be actually making doctor get engaged with the brand. So he must be aware of various interactions and the events SCP has experienced, and use them to tailor the sales call to the physician's unique situation and preference. Like I said, marketing department think segments, But very importantly, that last mile customer understanding and delivering the call is in the rep's hand, and he has to be extremely empowered for that. Probably he must know the interests revealed through the dialogues. He must know about the social media footsteps, and of course social media footsteps will be sent by the HO to this particular representative is engaging with the doctor. But all this information is available to him, and he has to make best use of it. So maybe the conferences he attended, his reactions to the to the conference and seminars, promotional material, various digital campaign company might have done, and how the doctor actually responded to it. All this information together is going to help him build this dialogue. Well, it's easier said than done because knowledge and data is always available. What one requires is empowering the sales force, but beyond that empowerment, there has to be super nuanced implementation of it. And for that implementation to happen, behavioral modification is very critical. So it's not only whether we know it, but is it in the end happening in the field? Because only if it happens there, we will see the result. Is the field force ready? And I would not generalize it. I would say it from my little experience in last 3 weeks to 4 weeks. Um, in terms of skills, attitude, motivation, and behaviors, are they really ready? So there is this bit of a problem right now. Sales representatives are kind of going through, and I got so many calls, and I got through social media, many representatives expressed something that which they were little not really comfortable sharing with probably their higher ups. And once again, I'm not generalizing it. I'm talking from the perspective of those who reached out to me. Uh, I have seen in 90s we had actually doubling up of field forces, and then came the last decade where everybody started talking about is it really worth? Is it giving me ROI? And all these representatives are privy to these discussions that increasing field costs, diminishing ROIs, and am I really worth it, or am I really needed? Is my territory important? And that's the question. We also know that a lot of digital strategies are deployed in the industry, and some of them do not include reps. Once again, I'm not talking about all, but there are representatives who feel threatened. They feel that am I really needed? I mean, if there's a better way of doing it, then am I really needed? There a lot of restructuring and downsizing has happened, and unfortunately some of it happened beautifully and some of it didn't happen that well, just with 2 or 3 months salaries. And we have ample of examples today where downsizing didn't happen the way typically it could have happened. There is a huge pressure for target achievements. We all know the suicides which have happened, the depression that Salesforce goes through. So this is the situation right now out there. And on the top of it, now we are saying that there is COVID-19 and again targets, incentives, and future that is at stake. I understand a lot of companies are giving incentives. They have restructured incentives. I also know that certain cup formulas and some vitamins and minerals have done well. So somewhere overall targets are achieved. But yet, has it taken away the fear from salesperson's mind? No, it hasn't, probably, and that's my understanding. Secondly, there is this insecurity, which is always, am I really needed? So right now, probably the need is to get best out of the rep. So it's not whether we are trying to replace him. No, that probably is not an answer, because internationally, if there is anything to learn, is that this sales representative is very important and is the one who engages doctor very well. So question is, how do we get the best from him? How do we get that additional value from the same field force? And not by adding pressure, but supporting him, letting him do what he's supposed to do and ensuring he does what he's supposed to do by helping them out and making them do it better. So how do we do that? I mean, of course, all of us have answers, but maybe there is something interesting that can help, and that's neuroeconomics and maybe artificial intelligence, and it's here to help. And Ramesh is expert on this. So I'm giving it to you, Ramesh. I'm sure, everyone is more eager to know from you how we can actually improve sales excellence and effectiveness. So thank you so much.
Thanks, Gauri. Thanks a lot. And I think that was an excellent, comprehensive overview of the healthcare landscape today. Also a very good peek into the future that you've given that says the way in particular sales reps need to be and what they are today, the two are quite different. I thought you also made a very interesting point that this change has always been there, but been taking place very slowly. And this whole COVID thing's accelerated that change. And the fact is that technology remains pretty much the same. It's always been there. Maybe it'll incrementally improve. Processes are pretty much there. But the important area really is around behavior, is around saying how do we therefore get the sales rep at the ground level where the rubber touches the road? How do we get them to change their behavior in a positive fashion that impacts them positively, therefore improves their performance, which means for the company itself, the overall performance improves. So that is the key question. And I like the questions that you asked in there. We'll try and provide some answers around how can we actually do it. So while we've agreed that change of behavior is an important element, and of course upskilling as well, how do you go about doing that is the topic of the next 15 minutes that I'll kind of walk through and look at saying how do we take learnings from a slightly unrelated area for typical enterprises, which is behavioral economics and behavior science, and what's today called neuroeconomics, which is a combination of neuroscience and behavioral economics. How do we combine these two? And in order to impact people at large scale, how do we therefore use technology and AI to do that is the topic that I'll touch upon now and actually walk through a few live case studies and examples, and we'll take questions later. So we'll talk through about saying how can neuroeconomics and AI solve this conundrum that Gauri's raised about saying the new age sales rep, or what she that phrase of being rep ready. How do you get the sales reps rep ready in the current context, the way things are changing? Most of us agree that post this transition now, we will embark on a world that's going to be a little different from what we have today. And a lot of examples were given. I will also touch upon how can we handle this hybrid model that we're going to have of some degree of remote working and some degree of on face-to-face interaction. How do we kind of tackle this combination? What are the challenges and how can it get tackled effectively? But before I do that, there will be a poll that will get flashed to you. And I want all of you to just quickly answer this poll, and then I'll take it from there on. So please answer the poll. There are two questions that are going to come one after the other. If you can quickly answer those two questions, I will then proceed with the rest of this.
I'm just putting on the first question.
These are very simple questions. We just do very simple questions, and they are personal questions for all of us. This has nothing to do with technology or with macro or micro or behavioral economics. These are personal questions, and these are questions that are relevant in the current context.
So I'll quickly launch the second question. I'll just wait for 5 seconds. I've just launched the second question for the poll. You can go ahead and give your answers. Yes, we have stopped the poll. Ramesh, over to you.
Thank you. Thank you. So there was a reason I asked this question, and the reason was in this period, which has been unprecedented. I don't think any of us have ever faced a period like this where we've been kind of locked into our respective homes for such a long period of time. And most people that I know have, the answers that I hear in the poll, and thank you for answering the poll. Answers that I hear in the poll are consistent with answers that I get when we talk to everybody else, which is saying majority of the people had some intention at least to say, let's get a little bit disciplined. Here's a chance for us, even though we are locked in, to be a little more disciplined. And also the majority of people are not entirely happy with what they've actually done. So there was a high intention to follow a fitness regimen or to get a little more disciplined about lifestyle. The majority of people 4 weeks down the line are saying maybe we could have done it better. And that's what the poll results also say. So why is this? Let's just drill this down, because this was also the subject of a similar study many years ago by a group of behavioral economists at Stanford University. Of course, not in the context of a lockdown, but in the context of the normal lives that people lead, which is what they asked a large number. And the answers here pretty much mirror what happened then as well. So let's just quickly go through. Most people had an intention of doing it, following a disciplined lifestyle. Only a small number actually followed. So majority of people are not happy with the way they themselves have done that. Why? Is it lack of knowledge? And if we think through, it's not lack of knowing what to do, right? All of us have a good understanding of saying what do we need to do to get more disciplined, whether it's diet, nutrition, exercise, the amount that you sleep, reducing your stress. So knowledge is not a barrier to have actually followed it. Yet we are unhappy about what we did. Is it lack of motivation? It's not, because clearly most people, even according to the poll, have said, yeah, we're motivated to do this. And that's something that we wanted to do voluntarily on our own. So it's not lack of motivation either. It's not also lack of understanding what benefit we get out of it. So all these three are available. You know what to do. You're motivated to do it. You know you get a lot of benefit out of doing it. And yet people are not comfortable with the result or the end action that's there. So are these three alone enough to take action? Was the question that was looked at by, like I said, a group of these Stanford economists. And they found that there is something missing in here to translate intention, motivation, knowledge of how to do something, and even the benefits are all lead to a good intention. But how do you translate that intent or intention into action is really a bit of that puzzle. A solution did come out of that, and I'll talk through that solution now. The solution, one of the solutions that came out of that, which proved hugely popular and hugely successful, is today well known as the nudge. The nudge, and the author of the nudge won the Nobel Prize for Behavioral Economics a couple of years ago in 2017. That's Richard Thaler. And in this book, he says a phrase, a sentence that he says is really true, that humans or people are not completely rational. And a nudge is nothing but a choice, an aspect of a choice that you give someone saying do something that changes behavior without changing any options or giving all the options to the people, and without changing economic incentive. So what does that mean? That means a nudge does not say, I will give you some incentive in order to do something. No, all it does is say, I have an intent to do something, and the nudge will help me convert that intent to action. That's what it does. So this nudge turned out to be very, very successful in areas of healthcare, in areas of public policy. And if you think about what Gauri spoke about sales reps also, or medical reps, it's not very different. Most of them have a good level of knowledge of what to do. They're also motivated to do well. And certainly they know what they get out of it, right? Which is the living that they earn out of it. But does that always intent to do well translate into action is the key question. And therefore, there is a possibility of saying, can we use the same principles of nudge or nudge theory to coach MRs on a daily basis in terms of converting their intentions on a day-to-day basis into action, which means that action gets successful because you've triggered it. And that feedback then gets the MR to continue doing those actions on a regular basis. So the concept of neuroeconomics, therefore, is to say, can we use principles of behavior science, and I'll touch upon it in the next slide, in order to trigger action from people, but in a way that they trigger action on something that they themselves want. So this can be done if you want to do it at large scale. You want to do it at 6,000, 10,000, 12,000 MRs. You have to use technology to be able to do it consistently. So this is not a training program, because a training program is a one-time intervention. And what you really want to do is to do this on a day-to-day basis, pretty much like our intent to be fit, right? Which is a day-to-day thing that you need to follow, not something that you decide once and then review a quarter later, but it's an everyday cycle that you follow. And the nudging is the same concept. So the way to really do that at scale is to also harness the power of artificial intelligence. So how do you do that? The way to do that is to use what in behavior science is called persuasive technology. Persuasive technology are nudges that persuade people to take action based on their intent, but also do that depending on the type of personality different people are. Different people have different motivational triggers. Some people are motivated by a sense of mastery, wanting to do something well. Some people are motivated by a sense of responsibility. Some are motivated by incentives. Some are motivated by wanting to do better than others. So each person has different types of motivation triggers. And persuasive technology looks at which of these triggers works for which individual. And therefore, for you to understand how to personalize this and say, we can't use the same principle for everyone, but can we personalize the kind of trigger or nudge for every single individual based on their personality? That's where AI comes in, because AI is able to look at saying, I've sent a nudge and I've looked at what is the response of that nudge for that individual MR. And over a period of a few weeks, 2-3 weeks, it gets better and better at understanding what motivational triggers move an MR to action and which ones don't. And that's where the machine learning or the AI comes in. And that feeds back into the nudge engine that nudges. So this is the concept that's really worked in terms of tackling the behavioral side, because we are not talking about giving more information, more analytics, more knowledge, because as we saw before, knowledge or motivation or benefits alone does not translate to action all the time. A lot of studies say that all of this knowledge, benefits, motivation translates to 60% of behavior or of performance. 40% is the gap that's due to employee behavior, which you can translate into lack of engagement, lack of initiative, drive on a day-to-day basis. And so that 40% is a massive gap. Now, this is the theory. We've actually implemented this theory in practice. How is that implemented? That's implemented through a mobile-based application, which is carried by MRs as well as the entire hierarchy of sales. So MRs, their managers, and the whole hierarchy up to the head of the business. And basically our application does tracking of daily performance based on KPIs. Those KPIs are taken from your or the company's enterprise systems. It could be a CRM system, a Salesforce automation, or multiple systems that are there. So our app, we do not replace a CRM. We don't create any data. We integrate with those CRM. So therefore, we take the same data that you already use at a transaction. Well, but our AI engine then does analytics on what kind of persona each person is, what kind of nudges we need to be sent to everyone, and does therefore coaching for individuals on a daily basis to drive the right behaviors. Similarly, it also triggers off to managers in terms of who are the people who are currently performing well, who are people who need a little more help, and therefore what actions can they take on a daily basis proactively in order to help their team do better. So that's the concept. It's now being deployed. We have over 1 lakh people using this application, users that are using this application across all of these companies, over 30 companies in multiple countries. We actually send out more than 3 lakh nudges on a daily basis. Every day, more than 3 lakh nudges. And we capture 10 lakh behavior instances every day. So as a result now, we are able to look at saying what are successful behavior traits in different industries for field reps, salespeople that work, and what are the kind of interventions, therefore, that can be taken on a day-to-day basis to help perform. So far, I've spoken about companies, I've spoken about a lakh people using this for the last few years. What is the impact? The impact is significant. And there are different companies that have different types of impact, but net, we've had average of 15% increase in sales performance, more than 5 times the number of people who've hit their target or achieved the quota, and so on, cross-sell and so on. So it's a significant business benefit that the company gets because every individual has improved. So the concept here is, for most enterprises, technology is top down. It's decided at an enterprise level and drilled down till the person at the lowest end actually has the most work to do but the least benefit. Ours is the reverse. The person at the lowest end, which is the MR in your case, gets maximum benefit but does almost no work on this application because it coaches him or her on a daily basis. So this is how it's actually being used up in the old normal. Now, how does this get used in the new normal? Just like Gauri spoke about how she's spoken to a number of people in the last 3-4 weeks, we've spoken to a large number of our, or got a lot of inputs from most of our 1 lakh users that we have, looking at saying, what does the new normal look like and how do we adjust to that? So if you think about remote work, which is what is happening today owing to the lockdown, once this shifts, of course, I guess we'll get into a hybrid. But if you think about it, most people said a lot of focus in this period was on how do you get the infrastructure to work remotely in place, right? Which could be the laptop, which could be connectivity, it could be security, the technology that's there, etc., which is the workplace and the technology. Relatively less on the behavior part. And for most people, being locked up is a significant difference from going to an office every day, working with your peers, being in touch with your hierarchy, and then going out and meeting customers face to face is very different. All of a sudden, you're locked up in, and there are a lot of concerns that come. And Gauri spoke about some of those concerns, right? Insecurity. Am I contributing enough? What's happening on a daily basis? What are the changes that's taking place? How's it going to be a month down the line? So there are a lot of concerns, questions. And that is where I think the importance of the new world or the new normal will begin to come in, where this is going to become a fact of life in terms of a combination of the two, which means there are new expectations across the entire hierarchy or new concerns. Frontline teams like NMARS got their inputs on a daily basis. Now, all of a sudden, they'll have to be much more independent. And I think Gauri made a great point that many of them have to reinvent themselves in terms of delivering quality interaction rather than quantity interaction. And she gave a lot of examples of how doctors are open to quality interaction. So all of a sudden, what they really need to do is very different from what they did earlier. But that's something they'll have to do to an extent independently as well. So there is a period of coaching that you do, which they will need in order to be able to do that transition to be more effective frontline marketing medical reps. Similarly, managers also have a problem because all of a sudden they don't meet everyone face to face on a regular basis. Now they'll have to look at saying, how do I keep my teams more engaged? How do I keep them? How do I know who's engaged, who's not? How do I know who's motivated, who's not? How do I know who to support at a point of time when they need help? How do I know who to acknowledge or appreciate when they're doing well? So all of a sudden, they have a different set of challenges. And the leaders, of course, have the biggest challenge about, which is saying, I have this large field force, and now how do I change the culture and the way they operate in a short period of time? And again, Gauri made that important point. It's nuanced implementation. It's good to have that strategy, but how do I know that it's being adopted at a frontline level in order for it to get effective? So our interactions with a lot of our companies that we are working with and the 1 lakh users is strategies have already come up in place, but it's the implementation that's really taking up time. And that's where what we've got has helped people a great deal. So we've looked at our learnings over the last 3-4 weeks and feedback from a lot of our users and looked at saying, behaviorally, what is it that's already changed and what's likely to remain changed now over a period of time? And therefore, how do we get our product to help with that? So I'll just quickly go through those. Number one, we've seen the entire area of performance management has undergone a shift. And Gauri pointed out some examples, right, which spoke about saying doctors now want quality of interaction. So it's a different measure all of a sudden, right? It's not about saying, have you met so many category A doctors and parroted, like she quoted, right, parroting, rather than having a dialogue. Now it's about saying, how do you have a quality dialogue with your customer? And there are other KPIs that change as well. So there is now going to be constant change of KPIs in order to enhance performance on the whole. Second is because of the distance now, which is physical distance, obviously, and people working more digitally, the digital channel is an excellent way to use for coaching. And if you can do that using AI and using, like I said, neuroeconomics earlier, which is saying, how do I therefore positively change behavior of people using neuroeconomics and deliver that through digital and artificial intelligence in terms of personalization for an individual? That concept of coaching digitally becomes a big thing now for field sales people because it's a constant set of interactions that they have. The third is also communication with peers, with the hierarchy as well. And we've got in our application, we've got what we call a notice board where you can use to communicate as well as use to do the next part, which is building ability. And again, Gauri spoke about the new traits of the salesperson that needs to emerge, which are different from what they are doing today, which requires therefore a degree of not only one-time training, but ongoing coaching and training or micro learning and micro training, which is something that we've got built into our application. We've also got an assessment or a quiz feature where you can figure out saying, have people really understood and have they adopted all the changes that they are supposed to do, and have they been successful in upskilling themselves? The next part is really being connected to your work groups, which could be a peer group, your hierarchy, and you interact with it in some form. And our nudges are actually not many to one. These are interactive nudges, meaning the user who gets them can interact with those nudges, ask questions, ask for more details, say whether you like that or not. So there's a lot of interaction that takes place. So in some sense, it's like a virtual coach, but a digital coach that people use. And therefore, it becomes something that they trust because it gives them information, it gives them coaching inputs that they find valuable, or they can say it's valuable or not, and it changes based on that. So in some sense, it's a friend for them. It's a digital friend. All of this, I think, will lead into what we today are calling the business unusual from our standpoint. A few months down the line, that will become business usual. But today, it's an unusual business for us because you have to adopt some of these new practices that are here, and that many of you in your companies are also going to look at it. So how do the old normal and the new normal work? The old normal takes a lot of things for granted. There is face-to-face interaction. You meet someone on a regular basis, and you go and meet your customers as well. And therefore, the monitoring actually happens over a period of time because some things are taken for granted. Under the new normal, a lot of that face-to-face will begin to come down. But you can use digital far more effectively. And today, people probably use the cell phone much more than they talk to somebody else. So this is an ubiquitous device that's there today. And therefore, you can use that to be able to coach people and understand their personalities, behaviors in order to get them to do better. And that becomes a cycle. And the same set of nudging then goes to managers who can use the same inputs, therefore, to align what the MR receives, or Raj in this case receives, to align. And therefore, for Raj, the inputs that he gets from the digital coach and the inputs he gets from his hierarchy are aligned and are similar. And therefore, it's a multiplier effect in terms of overall performance. One last word before I close this and then open it up for questions. Is this a CRM? It's not a CRM. Is it analytics? It's not just analytics. So what is it? A CRM basically provides information, right? It provides a transaction layer, and most companies will have an analytics layer that then cuts and slices that data, it aggregates to produce all of your strategies that you do. But we tackle the motivation and the individual drive, motivation, and the behavior of individuals in order to get them to use your CRM analytics to perform better. So with this, I'll stop. We'll open it up for questions. You can use the chat or the question feature to put your questions in, and between Gauri and I will answer questions that are relevant to each one of us. So thank you once again for taking the time out on this and on a Saturday to come in for this webinar. Please feel free to ask any questions.
So Ramesh, we have got questions. I'll just pass it on to you both.
Yeah. So, Maulik, I can't see this question fully. So,
Okay, I'll read it out for you.
just
How
read it out.
how e-detailing is really going to help for Me Too brands, say like azithromycin or say a product like Dexorange? And will doctors be really interested to hear e-detailing of such products?
Okay, so that's a very interesting question, and answer somewhere lies in brand building area than exactly in the sales representatives domain. But like I said, so it's a low involvement brand, and in that case, there are so many interesting things that low involvement brand do. Like for example, if you just draw a parallel to any of the consumer industry, we have almost every brand in a way is Me Too, but it has its own value proposition. So one is that your value proposition, and secondly, how are you going to engage your doctor in e-detailing, where your brand might not be at the center of the discussion. Maybe you will actually tell doctor about the value proposition, but you make the entire e-detailing interesting. Like for example, so many brands that I just quoted in last 5 weeks have done wonderfully well on phone with the doctors, were all low involvement brands. They simply said, doctor, I have a cough formula, and I understand that there is increased demand for it, and I understand your problems, the question your patients are asking, and he kept the doctor engaged around the brand. In the end, we are here to build a relationship with doctors, and that's what the sales representative does. And this seminar has a limited scope to explain it, but there are multiple ways by which low involvement brands actually make detailing very interesting, be it e-detailing or face-to-face detailing.
Ramesh, there is a question to
I hope
you.
I answered this question, Vivek. Vivek happens to be very, he knows this inside out. So I understand this question has come from a lot of deep understanding. So I don't know, Vivek, if I have answered this question completely. But well, maybe in some other time, definitely I'll explain what I really meant by getting the brand fundamentals right. So if the brand is brand ready, e-detailing is not difficult. Sorry, yeah.
Yeah,
Yeah,
thanks.
Ramesh, is the question visible to you or should I read it out?
No, it's visible. Thanks, Ashish. I'll read out the question for everyone's benefit. The question from Ashish is, how does nudge factor in historical elements leading to behavior formation? Would there be an assessment upstream to customize the nudges? Great question, Ashish. So actually what AI does is, AI looks at behavior. The way we've configured AI is behavior is defined much more narrowly. Behavior is not my intention to do something. It is action that I take. So if I intend to exercise, it doesn't count it as behavior. But if I've actually exercised, it counts it as behavior. Similarly, if a field MR has intends to visit 3 doctors, that is not behavior. Has visited 3 doctors, that's behavior. So what it does is it sends, to begin with, it takes in the average profile of pharma MR reps. And like I mentioned before, we get 10 lakh behavior instances per day. So we've got standard behavior instances, industry by industry. So we have what you can call an average profile for every industry. It starts with that average profile. Obviously, average profile means that across everyone, that's the average. So it makes that assumption. And then over 2 or 3 weeks, based on the nudges sent and the response, it begins to change it for every single individual. So then it gets personalized. By the end of about 4 weeks, it is completely personalized to every single individual. So that's how it automatically learns. So it's reinforcement learning. Strictly, we use AI, we use machine learning within AI. So that's how it learns about every individual and gets better and better at doing it.
So next question is Gauri ma'am to you. Can you see that question or do you want me to read?
see this. This question is from Manan. He is asking, but does the doctor see value in these AMR conversation? So, well, that's our job to make those conversations important enough to doctors. So if we do our basic stuff well, so when I say we at multiple levels, at a company level, at brand teams level, and then, like I said, the chief coordinating officer, who is this new rep, if he is fed with this information, and if there is going to be a dialogue and not one side parroting, doctors are going to find it interesting. So it's the answer is not that doctor doesn't see the value. The real question is that are we giving and providing that value to the doctor? If we are, I'm sure there are many doctors who see that value, and they are more. We have built so many wonderful brands in this country which were absolute Me Too brands. So there is no question about doctors not being interested in the conversation.
Ramesh, there is one to you.
Yeah, thanks. I've got a question from Jijo. Jijo says, this is a great idea put into action. It will be great to apply these principles in other industries beyond pharma sales. Is it possible to apply in product engineering, software development? So answer Jijo is, short answer is yes. What we've done so far is how I apply it in two major segments or use cases, sales and customer support or services, where we've applied it. In India in particular, field sales for banking, financial services, pharma, FMCG, and customer support is for primarily for BPOs. That's where we've applied it, and we can probably take it offline and discuss in terms of how it can apply in a use case like software development or product engineering.
Ramesh, there is one more question to you.
Yeah, thanks. There's a question from Amit. Very interesting talk by both speakers. Thanks, Amit, and thanks on behalf of Gauri also. Can we throw some light on what is the best way to launch this in organizations? I mean, every company has various app solutions for their field force, so this would be one more addition to those. How to get buy-in and motivation from field to drive this? Okay, very good question on it. So I agree. Every company that, and I showed you a list of the 30 odd companies that we are working with today. And like I said, this is complementary to a lot of the applications that are already there. In fact, our experience has been that from a field force side, there is least resistance, primarily because they do no work on our app. They do no data entry into our application. We don't ask them to enter any data. You look at practically every other application that they have to enter something on the app. So there's a lot of work for them. Here, it is help that they get. Our average, what we call engagement level, that is how many people come into our app on a daily basis, is between 80 to 85% across all of this. And it's all voluntary. It's voluntary because they believe that this helps them do better. We have many ways by which we can integrate to other applications. But one interesting thing maybe I can tell you is a lot of companies we work with have told us saying, one of the things that they want our application to do is to increase adoption or usage of existing CRM or Salesforce automation products because, and you will probably know this, most people who have a CRM or a Salesforce automation, the usage is not high or the quality of data input is not high. And it's not high because it entails a lot of effort that the salesperson has to put in. So one of the things we actually do is to change that behavior and to get that used more, because the better the quality of data in there, the better also the quality of coaching support.
Gauri ma'am, there is a question to you. There are actually two questions. If you can just answer them.
Yeah, I actually am being able to see one which says it's nice to see empathy for the field staff, and thank you so much. But more than empathy, I think all of us have realized that it's the representative who builds relationship. And when I was speaking with the doctors, and when they actually, some of them verbalize is saying that I'm missing sales reps, and I actually formed a WhatsApp group for them. So I think there's a lot more to this entire thing, and that's why even internationally sales reps becomes very important component of overall brand promotion. So the role may change. So it's basically it's a lot more than just a person out there and we are being sympathetic or empathetic to him. And I absolutely understand the pain they go through because we deal with them day in and day out. I can't see Sagar Tamboli's question, Maulik, completely. I just see the first two
I'll just
words of,
read out. I'll just read out for you. In your
yeah.
book, The Perfect Pill, you say representatives are fundamental to pharma companies. But given the ability of AI, do you really think so?
Yeah, I mean, this question it keeps coming to me saying that now we have so many alternatives. We have chatbots and we have several things. But like I said, in the end, it's all about the relationship that the person on the ground builds with the doctor. And that has stayed. It has remained one of the fundamental tenet of this particular industry. I wouldn't say what will happen over a longer or much longer period of time, but no, this representative is going to be very important. Just because he's not delivering certain value and he appears to be a lot more expensive in a given scenario, answer is not to drop him. Answer is more to, like Ramesh beautifully said, nudge him correctly, support him correctly, get those right behaviors on. So I think when I wrote the book, there are a lot of people who said that we would have liked to see cost effective ways of reaching out to doctors, but it's not cost effective to replace him. It's just not going to work. And that's not what doctors even want today. Probably what's going to work is help him out perform a lot better. I understand CFE models in pharma world deliver slightly lesser than other industries. So range being 1 to 7%. And Ramesh, of course, you are better to talk about it. I'm not authority on this. But the point is, they do a lot better. And, but having said that, uh, I guess the excellence model probably would do a lot better than just making representative irrelevant. So that's what I felt and wrote in the book.
There's another question to you, Gauri which
Add to what Gauri said. I think she answered it very well. And I think the role of technology is to actually help the MR do better. It's not replace. It is complement and help them do better. I think it's a better use of technology to do that today, because then you get the best of both worlds. You get the best of the personalization, the relationship that the MR has, which a machine will never get, but also the advantage of the AI that can do analytics and give it to you in the best form and get you to work better. So combination, I think, so it's not either or. I think it's an and question when you look at AI and a human being.
Right. Yeah, Ramesh, I guess you said it wonderfully well.
Gauri there is a question to you which says lockdown was used by pharma companies for training sales representative, training and coaching. What else do you think could have been done?
I think what wonderfully also happened by some of the companies was brand building. I mean, though a lot of us felt that this time is for learning, skill development, but there was so much more to do. Build brands if you are very clear about what your brand is offering. I mean, the value propositions and the whole idea around it. So a lot of promotion also happened, and some of the companies did it wonderfully well. A lot of good research happened. I mean, insight mining, this was a wonderful period for insight mining, because many doctors had slightly more time on their hand and they were more open to participate into, kind of research modules, but not question answers, but slightly more modified projective techniques kind of it. And many companies did it very well. So this lockdown actually, I don't see it as a break or interval in brand engagements. I rather see people actually use this opportunity to build their brands very, very beautifully. So all actually life was normal. It's just that we worked remotely. That's it.
So I'll read out another question. Digital coaching is very interesting. Is it only restricted to sales call, or it has the capabilities to coach the and other tasks? Any one of you can answer.
Okay, I'll take that. Digital coaching, yeah, it can apply in a lot of different contexts, like I said. The context that we've got a lot of experience and use in are the two that I mentioned to Jijo earlier, which is in the sales and the customer support area. It can get extended to a lot of other areas as well, but this has been our focus. So whoever it is, we can kind of connect up offline and discuss if there are any specific areas around that. But in sales, the impact is very direct, right? More than most other areas, sales is a very direct impact. You do it, you can see the result almost immediately. So cause and effect is much easier here than a lot of other areas that's there. Plus, honestly, particularly pharma sales is a difficult job. I mean, you have to have sympathy for an MR because it's a tough job for them, right? They're out in the field. It's a difficult segment to target as well. It requires a lot of knowledge. So there are a lot of difficulties that they actually go through. So if you look at any form of coaching and digital coaching in particular, I think the benefits that they themselves get out of it is enormous as a result.
The next question is, I think, Gauri ma'am, to you. It is from Manan. So he's asking if there is any value that an Indian doctor sees in an Indian medical representative.
Yeah, so more or less answered that question. We have to provide that value, and it's not that it's a doctor's job to see a value if you're not providing any value to that conversation. I mean, I know so many, webinars go empty just because doctors are getting 100 requests per day, and there are webinars which are excellently doing well, where doctors are participating because the value is getting added. So in the end, it's all about what we do more than what customer sees. And if our ears are to the ground, if we know our customers well, I think there is no dearth of customer intelligence.
There is another question which is from Kaushal. He is asking that how concerned are the doctors on the privacy of information? Any ideas on that? For example, the recent Zoom incident.
I'm actually not very sure to comment on this because there is something, every one of us is concerned and everybody is like, a simple thing is that none of us are using Zoom. So we all are concerned about it. Doctors are more, and doctors are also concerned from the privacy of the patient and not letting too much out. All these are given the social responsible behaviors. Within that, they are of course concerned. So but beyond that, not there is something we are doing and which will come out next week, Monday, and probably we'll have little more of this because we have tried to ask certain structured questions to doctors, and probably then I'll be able to add a little more value.
Ramesh, there is a question to you. I'll just read it out. Isn't there any upper limit to the level of competency you can push a person to through nudges?
Okay, so it's not about upper or lower limit. It is about saying I have, or each one of us has a certain capability. Can we get as close to that capability as possible is what the concept of the nudge is. That says, I mean, let's take an athlete, right? Athletes keep on improving over a period. Everyone has their limit, but ideally they want to do as well as they can, which is the same concept in here. That says, consistently over a period of time, can you get people, and I spoke about that gap in performance, which McKinsey, Forrester, Gartner studies have said that employees typically operate at 60% productivity. So can you get that 60% to move up to 80, 85%? That's a huge jump. Because if you look at it as a baseline from where they started, that's a massive jump. Not only that, it benefits the person themselves, not just the company. It benefits the person also. So it's about saying, can you get as close to your level as possible? That's point one. Point two is we live in a dynamic, changing world. So the metrics, your outcomes, what you're expected to do changes on a, of course, nowadays it changes on a monthly basis, but either way it changes on a quarterly and definitely an annual basis. So the treadmill is moving all the time anyway, and you're expected to keep up with that and keep going forward. That's what this concept of neuroeconomics tries to do, which is build that motivation, drive, engagement in people to do the best that they can, and therefore keep up with what their expectations
are. Another one to you, Ramesh, from Sagar, which says, what are companies in other industries doing to prepare themselves post-COVID from a sales standpoint?
Okay, interesting questions, Sagar. We've actually had in the last 1 week 3 companies that we know of, which are 2 of them are our clients, that have already put together a design for what they call the hybrid model of working later, which is part remote and part face-to-face interaction from a sales people standpoint. Have also looked at saying what are the different metrics that will change, what are the processes that need to change, what kind of training, upskilling that needs to be there, and what kind of tech to put in place. Of course, two that are our clients are using our tech in order to do that. The third one that came and said, we want to use our technology in order to do it. But increasingly, I think this is people are preparing, and I'm quite impressed with the level of detail at which they've actually gone into preparing. That says, what are the different scenarios that are likely to unfold over this time? And how will salespeople operate within that scenario? And how will they do it in such a way that their productivity not only doesn't get impacted negatively, but also improves positively? Because the reality is, face-to-face interaction is also time consuming. I mean, if I have to, in a pharma situation or an FMCG, which is where we got a lot of this from, in FMCG, I have to do total 40 calls of retailers. It's time consuming because you have to go commute retailer by retailer. It's possible now to reach out to other A category retailers much more efficiently and a much shorter time frame if you do part of it remote. So you can do a combination, which is what they're looking at, saying, how do we therefore start doing combinations of contacts in terms of remote as well as face-to-face, but in such a way that the total volume actually goes up compared to what you were doing earlier. And like I said, very, very detailed work that they've prepared in terms of how to do that. And we are helping a couple of them with it already.
Ramesh, there is another question from Madhusudan. He is saying, what are some good practices for setting up KPIs for driving behaviors?
Okay, good question, Madhusudan. So because we are a behavior science oriented technology firm, we look at KPIs or metrics a little differently from the point of view of monitoring it. So let me kind of elaborate on what I mean. If you give an MR a beat plan that says the MR has to meet so many doctors on a daily basis, what is the one is you can monitor and say how many have you met, why haven't you met so many, and how are you going to catch up on your backlog, which is a monitoring mechanism. But look at it from the MR standpoint. From the MR standpoint, what is the behavior that you want that MR to do? You want that MR to comply with that beat plan on a daily basis. And this is daily compliance, right? It's not saying another month I'll comply with it, but every day you want them to do something. So from our standpoint, the behavior that our engine tries to push is compliance or adherence, adhere to a repeated schedule. So that's one type of KPI. Another type of KPI is a target, right? It's a revenue number, and it may be a derived number, but it's a revenue number that you need to have. What is the behavior that you want of a salesperson who has a target? You want them, the behavior you want is a focus, meaning you want them to keep that number on a daily basis in mind and say, through the month, I will make sure that I try and hit that number. Or if I'm lagging behind, I'll see what action I need to take in order to meet that number. But I'm focused on that number always, right? It's like running a marathon. You're focused on finishing that 26.2 miles. And so you say, how do I finish? So focus is the behavior that we want. So we look at KPIs from a behavior standpoint and say, what behavior are you trying to achieve? And how do you do that? And there are different types, like I told you.
Gaurimam, there is a question to you from Manan. It says, knowledge is something that doctors don't have a dearth of. Beyond that, please give an example of value addition.
Manan, you will have to read my book. There are enough examples there. And anytime you're open, I mean, maybe this platform is not for sharing case studies, but feel free to write to me and I will be more than happy to interact with you. So, so it's not, I can't give answer in 2 lines. So anytime I'm open.
Ramesh, there is a question to you from Amit Bagaria.
Yeah, I got that. Yeah, I'll read that question out. Thanks, Amit. While you mentioned about new expectation across sales hierarchy, but any thoughts around delayering in sales layers? Also, interesting term CCO for traits of salesperson, but do you think it will also lead to Uberization of reps? Great question, Amit. I'll take the first. I'll leave Gauri to answer the second part. I'll read it out for her again. But yes, I think it's a good point that if you get a lot of digital coaching in there, currently our experience has been that it has resulted in increase in span of control of each layer. Simply because now you have technology that supports a first level or a second level manager or supervisor in terms of saying who to focus on, who to kind of appreciate, what is to be done, what are the key events that have taken place. It therefore frees up time for that supervisor to actually value add rather than, just monitoring or, reviewing every person. It doesn't add a lot of value. So what we found is definite increase in span of control by, depending on the client, 20 to 40% increase in span of control. For you, Gauri, the question is also interesting term, CCO, for traits of salesperson. But do you think it will also lead to Uberization of reps? I thought very nice way to put it, Amit.
See, whether you call it by any name, but that's what is required, in the field today. That poor fellow is trying to enter doctor's clinic with one little piece of, visual aid or whatever he has in hand, or maybe iPad little, that could be Uberization maybe. But the point is that we have to give him something by which he actually starts the dialogue. So the point is, he's an orchestrator of this entire symphony. Today he cannot simply go finish his job and rush for the next call and sit in waiting for hours for the doctor, again to just parrot read what he has. So if he has to add value, he has to be inputted with whatever doctor did, with communications that he had in the past, the kind of things that he served on the net, and then later on he has to kind of synchronize everything to talk to him. So whatever we call it, and I also like the term you use, but in the end, that's what is the job of a future rep. So whatever we call it, that's what is going to work.
Ramesh, there is a question to you from Saugata.
Yeah, Saugata, I'll read it out. In pharma business, FLSM stroke SM drives the FF. Field force, I'm assuming. How AI can help them to coach, motivate, and measure performance? Good question, Shogata. So what AI actually does is, like I mentioned before, operate across the entire hierarchy and chain, not just at the field force. Field force, of course, gets maximum benefit because it's a daily basis that they get it at. But importantly, the AI, the coach that we have, also coaches the higher levels in the hierarchy. And the way it does that is in helping them manage their team. So if I am an SM managing X number of MRs, for me, of course, one is the numbers, and I can see the numbers, right? But for me, the critical question is, who should I spend a little more time with? Who should I support in which area? Where is somebody a little weak and they are lacking? Where is someone doing well that I can appreciate and acknowledge in order for them to get motivated, do better? So those are typically the questions that I have. And in the normal context, you kind of treat everybody the same and go through a review of everyone. But AI helps you answer these questions, and therefore focus or channel your energies much more productively into areas where it's needed, and take out, if you like, non-value added work that you have. And therefore it helps in terms of motivating the field force. And you're right, it's also about saying, finally, that's the person that has the maximum impact on that field force. So what AI or what we try to do is to help them do their job better.
Ramesh, there is one last question for you from Divya.
Thanks, Divya. I'll just read out. Is this AI-driven model likely to help organizations get rid of laggards or poor performers? Or will it help them coach this group to improve performance? Okay, great question. By and large, the assumption that we have is, when people are poor performers, there could be a variety of reasons beyond why they are poor performers, right? It could be lack of training, lack of capability, lack of coaching that's there. And remember, a lot of the field force that comes in, particularly fresh field force, are people who just about graduated from somewhere and then get thrown into the field. And in most cases, bulk of their learning is on the job learning. And that's a little variable. If you get a group that's very good that you're working with, you're lucky because you can learn quicker, or a supervisor. If you don't, or you're in a remote place, your opportunities to learn are much less. So essentially, the concept of AI is to say, how can you coach them to improve performance? And it does look at saying performance is not just outcome, because outcome is a function of effort that, as a salesperson, I put in. So it looks at saying, what is the effort, what is the level of engagement that people have in order to do that. So bulk of it, that's the concept. However, there will always be some people who are not engaged also and therefore performing poorly. And that could be because they are probably in a job that doesn't suit their skills and they need to look elsewhere. But that's something that gets highlighted by our application.
Ramesh, I think it is time for us, as there are no more questions. So on behalf of all of us at WorkZogo and Brand Inner Health, I would like to thank each one of you for taking your time out and attending this webinar. Thanks to Ms. Gauri Chaudhary and Ramesh Srinivas for their talk. And we hope that we come out of this situation soon and we can leverage technology as much as we can.
Thank you. Thanks, everyone. Thanks to all the attendees for attending. And the questions are frankly brilliant. I like some of the phrases. Amit, I'm going to borrow your phrase, Uberization. I think it's a very nice phrase. Very good question.
Thank you. Thank you, everyone. Thank you, Maulik. Thank you, Ramesh. And it was really great interacting with real brains in the pharma industry. So it's great. Thank you.
So in case anyone has any further questions or anything, please do write to us. My email ID, you must be having my email ID. So please write to us. It's maulik@workzogo.com. Thank you, everyone.
Thank you. Thank you, Bob.
Thank you.